Hi, my name is Joe Jablonski, and I am a junior here at Davenport University, currently in the nursing program. So today I'm going to be talking to you about urinary tract infections and urinary stone disorders. Both of these diseases pertain to the urinary system and the renal system, depending on the severity, which then can cause serious damage to your kidneys. So to start, I'm going to start with the urinary tract infection, which is a bacteria that is introduced into the urinary system through the urethra. It's more prevalent in women only due to the anatomy of the urethras of the females as compared to the males. The age of those who are affected by this is also not dependent, just due to the fact that it can affect anyone across any age range. The prevalence, as I said before, is more laying towards females due to their anatomy, but males can also have this. Females have a shorter urethra, and also cleanliness due to just the difficulty of keeping the vagina clean is going to be something that plays a factor in getting this disease. It is affecting 150 million patients per year and can occur at home or a hospital setting due to the fact that you may need either a straight catheter or an indwelling catheter placed during your time inpatient. The signs and symptoms of a UTI is going to be your increased need to urinate, pain when urinating due to the inflammation that's occurred, abnormal urine characteristics, so the bacteria has started to introduce itself into your urine, which will then cause changes that will be known if you do look at the consistency of it, urinary retention, and fever in the event that it goes systemic into your system where your body has to now try to fight it in any way possible. So with that fever, that also can point towards pyelonephritis, which is going to be something that's discussed later, that can be much more severe and much more intense in the event that it does occur. Risk factors of a UTI and also the organ dysfunction, it's going to be pertaining to unsafe sex practices for females in the event that they don't use any type of protection, or if they're not using proper hygiene methods so that they can ensure no bacteria stays following intercourse. Your age is also something that's dependent due to the fact that if you are hospitalized, you may have urinary retention, and the easiest way to get that out is through a straight catheter. And if aseptic technique is not used, you may have these bacteria that make their way into your urethra. Although those who are immunocompromised, those are going to be ones that are at risk of getting a UTI just to the fact that their body doesn't have the equipped defense mechanisms they need to fight off an active infection. One point with all these stars around this is sterile procedure is very, very important when it comes to placing any type of catheter into another person. You need to make sure you follow every step just to ensure you're not increasing the risk of a UTI, just because this is going to cause much, much worse symptoms and effects on the body in the event that you break sterile field. So you definitely need to make sure you're paying attention to every step you take when you're doing this in a hospital setting. Organ dysfunction, this is going to be where your pyelonephritis comes in, which is going to turn into hypotension because your body's working harder and your blood is going to be circulating through the kidneys trying to break this infection out. So with hypotension, you're going to be feeling much more lethargic, and that's going to cause much worse effects all over your body. And then tissue dysfunction is going to be blood and pain upon urinating, just because these inflamed tissues are going through so much trauma, and that can cause micro tears in the cells. So you need to be very aware that these are something that can happen in the event of a UTI. As for the diagnosis, you're going to do a urine test to see if there's any organisms inside the urine that are going to lean towards whether or not there is the bacteria in your urine. That's probably the best way to find it, because they've lined the inside of your ureters and your bladder, and they're going to be multiplying at a pace that can be seen. If there's more than 100,000 colony forming units of bacteria per milliliter, that's how you can kind of determine not only if it's present, but also the severity of their multiplication. And then also with that, you'll have in a CBC, or complete blood count, you're going to have higher white blood cells, because your body is recognizing an infection, is going to do everything they can to kind of remove that. So those are kind of the two things you'll see with the urinary tract infection. Treatment, this is going to be more based on medication. There's not many non-pharmacological treatments inpatient that you'll be doing. You're going to have a full spectrum of antibiotics. Also, while they're going to be pushing fluids into you to try to flush all these bacteria out of your body, you'll be monitored entirely. They're going to be measuring your input and your output just to make sure you're not retaining. But these antibiotics are going to be trying to break and kill off whatever organisms are actively inside of your body. The reason this is the first choice is just because it's so easy to attain when you're in an inpatient setting, and you can also be sent home on these antibiotics to ensure that you get through the entire course, which is going to be the next point. You need to make sure if you are given a full course of antibiotics that you finish the course of antibiotics. Even though you might not feel the signs and symptoms of a UTI, it's still present, and you need to make sure that every pill is taken until the antibiotic is run out, so that you're fully destroying the bacteria instead of just allowing them to go stagnant for a little bit and then come back even worse just because you thought you were feeling better with the absence of symptoms. Complications, this is something that happened to my fiance a few years back and is the reason I am currently in the nursing program. It's going to be a serious infection that will spread up your ureters up into your kidneys, and your kidneys have a variety of functions, and if they're hindered, your whole body systems is going to lead or go downhill, which is a very scary thing. We were at Butterworth Hospital, and my fiance had a fever of 104 for about a week, vomiting profusely, severe hypotension. It was definitely a scary time, and with kidney damage, it's very, very important to reverse this as soon as possible. So we were in the hospital for about a week straight. They measured her intake and output, and they did everything they could to get rid of this active infection. So this is going to be very important when you're looking into the kidney function, because there's so many things it does that you don't realize, and making sure you treat this infection is going to reverse all the systemic damage that's done. So prevention of UTI is going to be proper perinatal hygiene practices. So after intercourse, or if you're in an environment that is high in bacteria, and make sure you clean every orifice or crevice or opening you have to make sure that that bacteria hasn't intruded and is waiting for the opportune time to multiply. Hydration is also key, because the more you drink, the more you're going to urinate out, so you can kind of flush your system, which is a great thing to have. The prognosis of this is very good. It's not one that will lead to death unless pyelonephritis is severe enough that kidney damage and kidney failure occurs. With the short-term quality of life, it's going to be hindered just because of the fact that the pain and the frequent urination is going to kind of pull you away from your activities of daily life. For the case study, it brought up a case about a woman who came into the clinic feeling sudden urgency, frequent urination, and pain with urination, and you can note that these are all the signs of a urinary tract infection. Also, she did have a history of urinary tract infections and had multiple partners who chose not to use any forms of contraceptive. The only notable lab test that I could find was the urinary specific gravity was 1.035, and you want it to be 1.010 to 1.030, which is significant because of the concentration of your urine can show that there is an active infection. Moving on to the UTI case study, there was 8 questions you could ask a patient if you're in a hospital setting. First of which is, do you have any kidney pain on either side, which is that flank pain due to the obstruction? If you had any recent surgeries, if you had any recent hospitalizations where your urinary catheter is inserted, that's the same kind of thought of the presence of a bacteria, introduction of bacteria with breaking sterile field. Is there any possibility that you're pregnant currently? How much water do you drink in a typical day? That's going to be pertaining to hydration status and the ability to flush out bacteria. Do you use proper cleaning methods following sexual intercourse? Are you taking any current antibiotics for a different ailment, which is going to decrease your ability to fight off an infection? And have you ever been tested for diabetes? The next question I chose was, what is urobilinogen? It can be found in the intestines, and there will be a conversion of bilirubin, where 1/2 of bilirubin will become a byproduct. It's a highly soluble substance converted in the intestinal flora. It's commonly excreted through feces, which is a high area of bacteria, and it can be related to your liver and kidney function, so you can kind of determine whether or not there's multiple organ damage with a UTI. The next question was, what is the significance of a positive leukoesterase and nitrate findings with a dipstick analysis? With the leukoesterase, this is going to be the presence of white blood cells in your urine, which is also known as pyuria. It's common with this urinary tract infection because your body has recognized the infection or bacteria and is going to send its defenses to try to break it apart and then remove it through the bladder. As for the nitrates, that's also another thing that's going to be involved in attempting to remove a active infection. So these two things coupled together are going to be your body's defenses trying to recognize and then destroy and remove a active infection inside of your urine. Go to the urinary stone disorder. It's also called a kidney stone. It's something that's actually fairly prevalent in all ages across the board for any individuals. So urinary stone is considered an obstruction of your ureter, but it can also be inside of your kidney. It's a very painful disease that will cause you to be laid up for a few weeks or however long it takes for you to pass that stone. It's considered four different types. So you've got your calcium oxalate and or phosphate, your magnesium ammonium phosphate, uric acid, and cystine stones. The reason they're different consistencies or makeups is because of the fact that they're made up of different substances inside of your body. So they will essentially do a test to see which kind they are dealing with and then take the proper action to attempt to remove it from you or allow you to pass it through your urinary system. The prevalence, it's any age or individuals. That's what I said as before. It's not going to pander towards a specific race, age, gender, and it really just pertains to hydration status and elimination status, whether or not an individual can empty their bladder fully or if there's something that causes this blockage. Also, those who have a high diet of calcium or oxalate are going to be those who can form calcium oxalate stones. So I have a slide later on that talks about the foods you should and shouldn't avoid. Risk factors, it's those who don't hydrate. That's a big factor that plays into it, and that kind of builds up the concentration of your urine. If you have urinary retention, you're going to also increase your concentration due to the fact that you can't void your bladder. If you have family history, that can also play a role in whether or not you can get this disease. What you do for a living, if you get frequent water breaks or if you don't have time to take frequent water breaks, is going to increase your risk. If you do eat foods high in vitamin D or calcium, you can have the risk of the oxalate stones I discussed earlier. Just going back, it's all about hydration when it comes to trying to avoid getting the stone. This isn't a guarantee, but you can minimize your complications if you do try to flush your system periodically. The symptoms, it's going to be pain with urinating and then inability to empty a full bladder due to this obstruction. You'll also have blood in your urine, which is going to be a pretty notable sign. It's something you can kind of see for yourself so that you can realize something's wrong. And then if you look to the right, you see that man holding his backside on the left and right. It's going to be flank pain is what it's called, which is going to be a pain that arises due to that obstruction in your ureters. So you can kind of feel that area of inflammation or pain. So those are going to be your keystone symptoms you're going to have to look for. As for dysfunction of the organs and the tissues, the blockage of the organ can lead to cell death because there's no proper blood flow that's going to that area. And then tissue dysfunction, you're going to have these micro tears due to the stone that is sitting in there. It's not going to be a perfect circle where it slides smoothly out. It's going to cut the tissues as it comes out, so that gives you a risk for bacterial infections that can lead to systemic blood infection. Diagnosis, you're going to want to use an x-ray just so you can kind of visualize the size and where the stone is at. So that's one factor that plays into it. You can also do abdominal ultrasonography, which is going to also be the same concept where you can see what you're doing and see what you're working with. That's going to be a big factor when it comes to trying to treat these stones, just depending on the size. If it's small enough you can pass it, they're not going to use the sonography, but in the event they do, they're going to have to use more surgical means to remove it, whether it's through direct removal, which is very rare now, or if they use wavelengths to break it down. Treatment, as I said before, it's going to be dependent on the size and location. If it can be passed, then that's going to be the go-to for that. So it will be painful, is what I've heard throughout a lot of personal experiences with it. It's something that feels as if it's tearing as it comes out. And if it's smaller than 5 millimeters, that's going to be the cutoff for if you can pass it or not. But you can also use a shockwave lithotripsy, which is going to use shockwaves to break it down so that you can pass it in a safer and less painful way. Complications, so this is going to be vital for urinary waste because you have to have your ureters and kidneys working together so that you can eliminate all of the backed up urine, which can lead to bacterial infection if it goes stagnant in your system. The good thing about this shockwave lithotripsy is there's no real side effects due to the fact that it's not invasive. It's on the outside. It's just going to break it down. The only thing that is going to be of importance is the risk for infection. You're going to want to make sure you're not running the risk of these micro tears causing bacterial infection inside of your system. Prevention for urinary stone disorder is going to be more leaning towards your hydration, exercise, and diet status. These are three things that are going to increase your immunity and your ability to remove toxins that build up in your system. So, hydration was one that I stressed multiple times throughout this that I want to kind of keep hitting the head on the nail for so that you can understand the importance of hydration. If you do have a higher than normal calcium intake, this may be something you may want to reduce just to reduce your risk of those stones. Red meats are known to have a high purine content, which then can become a cystine stone. So there's no need to remove meat entirely from your diet, but reducing it may be beneficial for you. If you look to your right, I have an image of foods that are high in oxalate and then an image of low oxalate foods. So your examples of high oxalate are going to be your seeds and nuts, your pumpkin, chocolate, and then beets. Beets were stressed throughout a lot of the research I did that are high in oxalate and something you really need to be conscientious of if you are ingesting that. Your low oxalate foods are going to be the ones that you can enjoy without a higher risk of a urinary stone formation. So you've got your bananas, your lettuce, your peppers, or your cantaloupes. So you can enjoy those in moderation so that you're not completely removing the oxalate from your diet. The prognosis of a urinary stone disorder is very similar to a urinary tract infection. There's very rare cases where an individual will have severe organ damage and can also lead to death due to this infection or disease. So it's going to be all about the time you recognize the symptoms and then the time that you remove the stone from your urinary system so that you can begin that normalization of your urinary and renal system. So the one thing is your quality of life due to this pain may cause you to slow down or feel like you can't complete the activities, so it will be difficult to maintain your exercise level. So you just have to realize that it will pass, and you have to understand that there's going to be times where the pain may be severe, but the outcome will be much better if you can of the situation that's going on. The case study presented a 56-year-old male who came in with severe pain on his backside in each side of his hips or upper hips, which is that flank pain I mentioned earlier. He had a history of 3 stones, which puts him at a higher risk of stone formation. They did a urinalysis and found that he had heightened white blood cells in his urine, which is that pyuria I mentioned earlier, in addition to red blood cells, which is going to be a signifier of an infection or blockage occurring. The primary thing you need to take care of first is going to be his pain, because he's not going to be able to understand the situation and then move forward if he's only focusing on his pain. So once this has been managed, you can educate the patient so that they can understand ways they can reduce their risk in the future, and also how to pass the current stone so that it doesn't cause even more systemic problems throughout the urinary tract and the renal system. A variety of questions, but I chose these 3 just because it pertains more to a clinical setting. The patient was given a multitude of different kinds of medications, the first of which was promethazine. It was wanted to know what the action of promethazine was. He had nausea and vomiting due to this blockage, which then can also be a signifier of a urinary tract infection. It blocks the effects of histamine, which is started in your medulla, so it's going to be a response your body takes to an abnormality so that it can attempt to reduce the effects of the infection. The next question, in addition to male gender and Caucasian race, identify 4 more risk factors that likely contributed. As I mentioned before, he did have a history of stones, which he most likely was educated on ways to reduce this through proper hydration and exercise. So that's one thing that he may not have taken his doctor's word for. In his chart, it said he didn't exercise on a regular basis, which is, as discussed before, something that's very important. His BMI was 25.4, which puts him also at an increased risk of kidney stones. The last thing is he is taking rabeprazole, which is a proton pump inhibitor, and they've been doing a lot of research and finds that also does increase your risk of developing kidney stones. The last question is it appropriate to give this patient penicillin for his urinary stone reoccurrences? The answer is no, it's not appropriate. They have been doing a lot of research that broad-spectrum antibiotics are creating multi-drug resistant bacteria, which then can increase your risk of creating stones. So this is something that must be taken into account when you're treating this type of patient so that they can understand what meds are going to be beneficial and what meds may be detrimental for their health. Comparing a urinary tract infection and urinary stone, you can find that they both involve the urinary tract and can cause serious kidney damage if they're not treated. The pain can cause a lot of decreases in activities of daily life. The 2 things that you need to know is proper exercise and hydration are going to be key for reducing your risk of both urinary stones and urinary tract infections. And the amount of time you allow for these bacteria or the stone to lay dormant inside of your system will increase your risk of long-term health impacts because of their ability to cause more systemic infections or systemic blockages in the other organs. The differences between that is UTIs are going to be caused by an active infection that are going to be introduced to your ureters. They are treated through antibiotic therapy, as urinary stones are going to be for more letting it pass or using the shockwave therapy. And with urinary tract infection, it is more common in females over males due to the anatomy. Urinary stones are treated through allowing them to pass, as mentioned above, and the shockwave lithotripsy. So that's something that you would never use on a urinary tract infection because it would have no effect. The pain has been much more severe for a urinary stone versus urinary tract because of the blockage that occurs and the stretching of the ureter. And then urinary stones don't pander towards a specific gender, race, or age. So this is something that's going to affect any array of people, so that you need to be conscientious of the signs and symptoms so that you can treat it immediately. So that was my presentation on urinary stones and urinary tract infections. Thank you so much for being here. I hope that I was able to kind of educate you on different ways that you can prevent this and what signs and symptoms are prevalent for these diseases. Awesome. Have a good day and take care.